Hello dear friends, how are you today? I hope you are well. Here we are going to explain another question of cardiology. A 52-year-old man with a BMI of 27 is being treated for hypertension. He drinks around 8 units of alcohol per week and smokes 20 cigarettes a day. His lipid profile was done and shows a cholesterol of 4.2 millimole per liter. What is the single best referral for him? A. Alcohol support group. B. Smoking cessation clinic. C. Continuum management. D. Dietitian. And E. GP to start a statin. Okay, here we have a 52-year-old man with a BMI of 27. His BMI is a little increased, but is not so important. He is receiving hypertension, antihypertensive drugs. He drinks 8 units of alcohol per week, which is in normal range, and smokes 20 cigarettes a day, which is really high for the patients with increased BMI and the history of hypertension. 20 cigarettes is high. And his lipid profile is 4.2 millimole per liter, and it is in normal range. Okay, and the best choice here would be smoking cessation clinic. As we said, the patient has the history of hypertension, and he is using 20 cigarettes a day, which is really high. We must send the patient to smoking cessation clinic. Here we are going to explain it. Okay. Smoking is the number one factor for all-cause mortality of coronary artery disease and peripheral artery disease. This is very important note, and I am going to repeat it. Smoking is the number one factor for all-cause mortality of coronary artery disease and peripheral artery disease. To reduce his risk of getting heart disease, the best referral for him it would be a smoking cessation clinic. This man is well within the allowed consumption of alcohol per week, so referring him to an alcohol support group is incorrect. How much is too much alcohol? UK guidelines recommend that men and women should drink no more than 14 units of alcohol per week, no more than 3 units in any one day, and have at least 2 alcohol-free days a week, which is the alcohol consumption of this man is in normal range. Okay, the man's cholesterol level is within the normal range, as we said, so there is no need to start a statin. Here we have cholesterol levels for adults age 20 and over. Okay, ideal cholesterol is total cholesterol must be below 200 milligram per deciliter, or LDL, and LDL must be below 100, and HDL must be more than 60, and triglycerides must be below 150, and this is an ideal lipid profile. But borderline, if the patient's total cholesterol is 200 to 239 milligram per deciliter, we can say that is borderline. And LDL is 130 to 159, and HDL in women is 40 to 59, and in man is 50 to 59 milligram per deciliter, we can say it's borderline. And triglycerides, if it's 150 to 199, we can say it's a borderline. Okay, too high or low? If total cholesterol is more than 240, we can say that the patient has really high levels of cholesterol. If LDL is 160 to 189 milligram per deciliter, we can say that is high, but it's more than 190 milligram per deciliter, we can say that it's very high. And if HDL in women is below 40 milligram per deciliter and in men is below 50 milligram per deciliter, we can say that the patient has a low HDL, and we must think about it. because HDL is very important in cardiac disease than LDL, and it has a preventive effect for cardiac disease. Triglycerides is, if it's 20 to 499 milligram per deciliter, we can say that is high. But if it is more than 500 milligram per deciliter, we say that it's really very high. The source of this data is Mayo Clinic and U.S. National Library of Medicine. Okay, he could be referred to a dietitian to tackle his increased BMI. His BMI is a little high, but it's not important. But the most important intervention for him right now would be a cessation of his smoking. Here in this chart, I'm going to explain BMI and weight categories. Okay, if the patient has the patient weight is below 18.5 kg per meter square, we can say that the patient is underweight. But if the patient is in range between 18.5 to 24.9 kg per meter square, we can say that this is a normal range. The patient weight is ideal. Our weight, if the patient's weight is 25 to 29.9 kg per meter square, we can say that the patient is overweight. And obese, if the patient's BMI is 30 to 34.9 kg per meter square, we can say that the patient is obese. If the patient's BMI is 35 to 39.9 kg per meter square, we can say that the patient is severely obese. And if the patient's BMI is more than 40, equal or more than 40 kg per meter square, we can say that this patient is morbidly obese, and we must and the patient must think about its complications. Okay, here was a short explanation about the patients coming with the history of hypertension with using 20 cigarettes a day. Thank you for your attention.